you. And hello to everyone else, quite a few familiar faces. My story is not dissimilar to Sarah's, down to the hospital we trained at. And I've sort of followed her a year or so behind, really, in our careers. And much like Sarah, we're obviously we're part of a big but very close family. And so it always stood to reason that we would join in my uncle's passion for vasectomy, really. And if he was here, he would talk your head off, so you'd have to mute him. But he feels really passionate about vasectomy as a really safe and effective form of family planning for Australian men and their families, but also having linked in with Doug and had the opportunity to travel overseas to the Philippines multiple times, he feels very strongly about providing that option in developing countries particularly. And so got myself and Sarah on board. I think probably the standout for me, which affirmed my choice, I'm also a general physician, but I do vasectomies as well, is being in the Philippines and basically having a patient that had 8 children, none of whom were in a particularly good condition, in the sense that they had no shoes and they clearly, hadn't had access to clean water to wash themselves, and certainly looked quite malnourished. And I spent a lot of time crying because it was my first trip to the Philippines and it was quite shocking to me. But for that patient to be able to have a vasectomy and walk out, within a number of minutes and have a really, as I said, safe and effective method of contraception for his family, made me realize how important it is to be involved.
Yeah, thank you very much. That is so true. And what an experience. It helps you really make your career decision, doesn't it? I would just want to ask you a quick follow-up. In your practice in Australia, do you see that women are making appointments for men or doing all the legwork, or do you think men are doing it for themselves?
I think it's a combination. I think there's probably a large number of women who are driving the creation of appointments, but I find that it's a combination. There's quite a lot of men that have decided after their 3rd child or their 4th child that they wanted to take matters into their own hands and take control and actually do their part in family planning, after what's often been years and years, as we all know, of the female taking the majority of responsibility for family planning.